All right, thank you all for joining us tonight. This is our third and final of our social justice series. Tonight we will be talking healthcare with Hillary, who served in Mercy Volunteer Corps in 1516 and is now in Philadelphia as a nurse. With that, Hillary, could you introduce yourself to all of us and kind of tell us how you came to be a Mercy volunteer?
Hi, everyone. So many familiar faces and some new ones. So awesome. I'm Hillary. I completed the Mercy Volunteer Corps in 2015 to 2016 in Philadelphia. It's a few years later, and I'm still here in Philadelphia, which I think is also really cool and unique. I have no family close to here, so I went to college at St. Michael's College in Burlington, Vermont, and was able to be connected to my community service director, Laura Scott, actually was also an MB alum, who kind of steered me into the direction of kind of other volunteer post-grad opportunities. I'd been thinking about the Jesuit Volunteer Corps, and then she was like, oh, try this. And then I interviewed, and one of the first sites I interviewed at was with Andrew Vittori, who was a Mercy companion at Mary Howard Health Center in Philadelphia. And I had planned another interview with another site like later in the week, and I was like, no, this is great. Like, I'm done. I was hooked from the get-go, and I was really hoping for that phone call back from Andrea, and it eventually came, and I was so, so grateful. So as I said, I'm originally from upstate New York. I went to college in Vermont, so I'm very New England based. I have some family in like northern New Jersey, but a few hours away. So I'm had never really lived in a city, had never really kind of experienced public transportation in the way that it exists here in Philly. So, or even as like a main source of transportation to get around places. So it was quite a unique experience, but something that I am still here and I still am very grateful and excited for. And then through that experience in my Mercy Volunteer Corps year, I was exposed to healthcare and just nursing in the community health setting. Mary Howard Health Center is a healthcare for the homeless nurse practitioner run health center. So all the nurses out there, I know Kara's a nurse. I'm sure there's others. If Selena's on, she's a nurse as well. So nurse practitioners, I mean, I'm biased, but I think they're some of the best providers out there. And especially when underserved and marginalized communities, they really make a big impact. And in my role at Mary Howard, I kind of worked, my title was patient advocate, but I worked as kind of the liaison for folks that needed a little bit more assistance in going to like a cardiology appointment, or maybe needed help kind of navigating going to the pharmacy, or just kind of figuring out general health things they had going on that kind of extended beyond their regular appointment with their provider. So with that, I obviously got exposed to a lot of different healthcare settings, got to know some really awesome podiatry offices throughout the city, got to know neurologists, and just kind of to the point where it was almost first name basis because I had gone with so many different people to these same specialties. So of course, obviously I was immersed in this wonderful community health culture and experience, and just all of the services that this health center provided. It motivated me to go to nursing school. So then I ended up doing the accelerated nursing program through Holy Family University, which is in like kind of the northeast part of Philadelphia, and completed that program. And then actually I now work at Pathways to Housing, ironically, with 4 staff members that are now my colleagues that I worked with on my volunteer year site at Mary Howard. So the world is kind of very small, and obviously social justice, but very small in like, I think the social justice healthcare setting. And I've found myself kind of having many Mercy related ties. I also became a Mercy associate last May as well. So kind of furthering the Mercy kind of experience. Yeah, so I think I've been at Pathways to Housing, my shirt right here, was my first nursing job, and I've been in that role it'll be 2 years in November. So, yeah.
That's wonderful. Thank you for sharing that. So what does your typical day look like? What kind of things are you doing at your work?
Yeah, so Pathways to Housing is a really unique like job and a really unique organization in the sense that we, as a nurse especially, what I really enjoy is that like I kind of get to see the whole perspective of someone's life. So I get to see kind of where they maybe were living on the street, and then I get to see them get housed, and then I get to kind of see them throughout our primary care setting, and then I kind of get to just follow them throughout all of these different resources that I feel like is so often so important, because obviously, um, if someone doesn't have a home, telling someone that they need compression stockings in order to elevate their legs to reduce edema is not really going to accomplish anything if they're sleeping on a stool or on a chair outside in the streets. So there's a lot of things, barriers to healthcare that are impacted by living on the streets. So what's really unique is that Pathways works with people who are experiencing chronic street homelessness due to intensive mental health or substance use disorders and conditions, and then works with them to provide them housing. So in order to access our services, you have to have 1 year of documented street homelessness. So we serve the folks who are really, really underserved and marginalized. Most often have kind of need a lot of with other different types of housing programs or different types of community behavioral health settings or incarceration, or just a variety of different kind of mixes of all of those. So then in my role, we kind of get names through the city that are referred to us, and then we kind of meet people where they're at. So if folks are in from Philly area, Kensington is a really, really intensive area for opioid use. So for folks that are specifically using opioids, that's typically where we'll find them. So we'll kind of get a general idea, oh, this person's kind of at K&A, which is Kensington and Allegheny, like the corner of those streets at between 10 and 11. And then we try to kind of go out and find them and meet them at a corner and just try to see how we can kind of engage with them. A lot of people now in Philly, probably a lot in the Kensington area, they kind of know what Pathways is, and then we know that we provide housing. So we don't necessarily have issues really. Once people know that someone's potentially getting like subsidized housing, they kind of tend to really come out of the woodworks and find us. But in the beginning, and for some of the people on the mental health teams, it can even be up to a year of trying to engage people before they agree to even take housing, which I think also just goes to show how marginalized and really just underserved a lot of these folks are, and how many kind of extensive traumatic experiences they've had with healthcare settings and just kind of behavioral health services and just general kind of services to support the folks who need it the most. So that's kind of where my role as a nurse. So then once I kind of work with people when they're on the streets, and I work on one of the opioid-based teams. So my primary work is working with people with extensive substance use. So of course in Philadelphia, we have a really large kind of presence of fentanyl, as well as heroin, as well as benzos and opioids, but most of it is heroin and fentanyl. Those are our main kind of conditions that we have going on here. And I work with folks kind of on the streets and try to provide them support when they are living on the streets. And for anyone that's injecting IV drugs, of course, there's a lot of different things that kind of come medically. So from kind of general wound care to abscesses that develop, to just different kind of things that occur from where people are potentially injecting. So if people are injecting in their neck, their groin, kind of all of those different things, of course, pose very vastly different risks, as well as kind of just the overall aspect of injection drug use puts you at risk for endocarditis, which is an infection of the heart. And so these are just things that as a nurse are really, really important for us to kind of just keep an eye on and manage and try to practice nursing in kind of the harm reduction standpoint. So Pathways utilizes the housing first model, which means that we provide housing with like no kind of barriers and no prerequisites. So we know that people are still using substances, and we put them in housing knowing that they still have their substance use is present and active in their lives. So with that, we provide a lot of wraparound services. So I'm one nurse, obviously, for about 85 participants. And then we have 6 or 7 service coordinators, who most of them have masters of social work. And then we also have 3 to 4 peer recovery specialists, who are people with lived experience, as well as a team leader and an assistant team leader. So obviously as the nurse, there's only one of me and 80 to 85 participants with vastly different medical health conditions. So it's really a very big team. Obviously the team component is so important, because I can't be all of those different places at once. So what's really cool is that we kind of work so collaboratively and so collectively, because our folks are really experiencing a lot of very, very difficult situations in their lives. And we try to just kind of meet people where they're at and support them throughout. Some people, I found more recently, it seems that when we've engaged with people, they need to go actually right to the hospital. And in those have been a little bit more difficult now, obviously, because typically when people need to be hospitalized, I will go and support them to the hospital, and I'll advocate for them while they're in the hospital. So for so many of our folks, they kind of arrive to the hospital and they're just viewed as the drug addict or like the drug user, and they don't necessarily get this like comprehensive care that they deserve. And that's not to say that the hospitals might not be trying, but it's kind of words matter in those situations. And a lot of our participants and folks on our teams have faced massive amounts of discrimination and stigma related to their drug use. So it's really important, obviously, when they do decide to seek help, that it's that there's someone there to advocate for them to make sure that they're getting the care they deserve. So that's been a tough part. Obviously, in the COVID world is not necessarily able to be at the bedside, and it really does. It's sad sometimes to think about how much my job really matters in those situations, because I really shouldn't have to be there to advocate for someone to get better treatment in a hospital care setting. But I mean, really, me being there sometimes makes like the difference between someone getting their as needed pain medication like now or like 45 minutes later, which can really mean the difference between someone leaving the hospital against medical advice or someone deciding to seek care. And I say with the preface that a lot of the folks that I'm working with are not going to seek medical care until they actually 150% need it, to the point where they should have sought medical care weeks prior. So it's not that people are kind of seeking the ER for just like a bruised knee or like something that's very superficial and can be fixed anywhere else. I mean, they're getting to the ER and they're needing to go to the OR most commonly really, really shortly after. So I kind of get to facet a lot of different aspects of the healthcare setting. So I go to the hospitals and advocate for people, and then I also go to their outpatient specialty appointments. I coordinate dialysis, and then I kind of also just kind of generally oversee what's going on with the medical conditions of all of the people on our team. So not everyone is our primary care patient, but a lot of people are, and we just try to figure out ways to best support people where they're at. Obviously, everyone has a unique story, different health conditions, but we work collaboratively to try to make a difference in people's health outcomes.
Yeah, I feel like you've kind of already started to talk about this, but I was just wondering what social justice issues that you see in addition to what you've kind of already touched on.
Yeah, so I actually did a little webinar thing last week for the Sisters of Mercy for something they were doing in Philly. But one of the biggest things I've noticed during COVID right now is when I first started wearing a mask as like a regular kind of occurrence in like early March, I guess. My patients that I would encounter would immediately be like, I don't have the corona. And I'm like, no, I'm wearing this to protect you. Like I honestly like have been exposed by so many people. We've had staff who have had COVID. We've had patients who have had COVID. Like if anything, I am at such a high risk to expose you. And I think that that's a really powerful kind of sentiment that a lot of my patients and people I work with that are fall in these underserved and marginalized communities, they so often are kind of these people that are viewed as the other, and like it's like those people are causing this. And I think that a lot of people have kind of said that there's some parallels between the HIV and AIDS epidemic and how the original response was to that, and how COVID has also been impacted by vastly higher rates of inequality in Black and Brown communities, which is vastly the communities I work in. And I think those are really interesting intersects to think about, because there are a fair number of people who are on my team getting services that have lived through the HIV and AIDS epidemic and were in their young adult years during those the vast kind of hardships of that time period, and just kind of seeing how those are kind of affecting people at this time. So I think that's the stigma that people face. I think it's interesting too, because in the substance use teams, we have some people who have used substances for many, many years, and are much older, but we also have a fair number of people who look like each one of us. Like no one looks like they use drugs. And I think it's so interesting when I go with people into the hospital, and my patients might disclose that they've had a substance use history, and like all of a sudden it's like things just like change right away. And it's because they might not have looked the type. And I think that that's so common, like with dealing with people with different, like just realizing that there's no look to substance use, and there's no like behavior with substance use. Like anyone could look like they use substances and or have mental health concerns. And I think that kind of attributes to some of our like women on the team that I work with. They're injecting in kind of areas where you wouldn't necessarily see use marks on their arms to avoid, I think, more public potential humiliation. If they were to go to a grocery store, you'll see them kind of like really immediately pull their sleeves down so they don't see kind of their marks that they use from injecting drugs. And I think that that's just so important to take into consideration is just the stigma that people face, just every aspect. So like someone could be having their worst day and really trying to actually seek care and seek maybe possibly recovery, and that one healthcare provider in a healthcare setting or just kind of one person could really kind of change the trajectory of like what they're really trying to do. And it's so important to remember to focus on kind of person first and not the experience that they're having. But yeah, I think obviously people who live in Kensington, I mean, the zip code, it's kind of one of those things that obviously like zip code is a really big indicator of health outcomes. And Kensington, I mean, I can't even imagine what their health outcomes like statistically are, but I mean, COVID has really impacted that area. There's a lot of street homelessness. There's a lot of close quarters from drug use. There's a lot of vast poverty going on in that area. So, I mean, when you look at discrimination and all of these things, as well as, I mean, kind of the generalized statement of like communities that are impacted by drug use are kind of over policed but under protected. So like a lot of people have vast encounters with the police that are majority not good and not favorable for the person. For a variety of different reasons. But I mean, I think that people get targeted and I mean, for possession and things and are put away in incarceration for many, many years. And I think that those are aspects that kind of play into the lives. I feel like a lot of the younger people I've had have had a lot of kind of intersections with the foster care system, which I find really kind of an interesting aspect of the work I do. So at Pathways, I mean, obviously I've been speaking about adults, so we serve people 18 and over. So you can have children and enter our program, but you have to have, like, you don't have to terminate your rights for your children. You just kind of have to have a planned signed guardian of the child that will be kind of responsible for the child throughout the time. I mean, if you choose to want to take care of your child, we can transfer you to another program. So I don't work with children at all. Obviously there's a lot of different issues that would come up with children and substance use, of course. But yeah, so a lot of our folks face a lot of discrimination in a lot of different facets of their life, obviously, and just poverty on top of health inequality generally. And then also added in the substance use is just a lot of barriers for folks.
In doing this kind of work, what do you do to keep your spirits high and your energy when the work can sometimes feel stagnant or frustrating dealing with all of these barriers in society for these people?
Yeah, which I think has been really tough actually the past few months, which has kind of been interesting. And I'm sure there will be probably trends of data that follow this, is we've actually had a really significantly high number of people who have died from overdoses during this time period. So we've had people die from COVID, but we've had a far greater number of people die from overdoses. And I think that that speaks wonders to isolation on top of lack of resources. Because obviously, I mean, places in Kensington, like the soup kitchens, the organizations that were providing food to people, I mean, they've kind of all shut down or they've changed their capacity to maybe from 3 meals a day to 1 meal a day. So they're at a really high risk of overdose because now they're using their substances possibly without other friends or other people around. And so that's been extremely tough. And I think our organization has really tried to support people and our staff in the best we can. But I think it's really interesting kind of like, obviously, I mean, as medical staff, everyone kind of, you work through obviously a pandemic, but to kind of be working with people in an area where everything else is shut down. Like, I mean, I'm still doing a kind of emergent type home visits for folks. And it's kind of wild to see like the soup kitchens and things that are kind of just such steady kind of like statements in this community is being shut down because of just risk of COVID and risk of spread in an area that obviously has a high risk of that potential. But I think what what's really important, obviously, is kind of our relationships with our coworkers. I think what's so great is the team model of Pathways is so unique, and so supportive. And I think there are a lot of kind of wild moments that happen in our days, but there are also a lot of great and wonderful moments that I think a lot of us will cherish for so many years, even beyond the years that we work at Pathways. And I think that's what makes it all worth it. There are, of course, times where you're at people's worst moments, and then there's times where you're at their best moments. I mean, and I think that both have great power. I've learned so much from people throughout my like 1.5 years at Pathways. I mean, it's kind of wild to think about some of the first encounters I had with people when I first started at Pathways, and to the relationship and to how far it's grown since then. Trust is such an important aspect of our participants' kind of lives, and when you establish that trust with them, it's really, and they really value that, and it's really important, and to keep that. And I think going on to like self-care, I think that it's just really important. I think in any job, I mean, especially in like kind of the social justice world, is to kind of be able to take a step back and separate. I think so often I feel like people in the social justice world, it can be very hard to separate from your work. And kind of take a step back from it. And I think those are things that I think everyone kind of, the work-life balance, kind of try to try to figure out the best way that can happen. I know Pathways has like an on-call system, so certain calls that come in the evening, another person will kind of answer week by week. As the medical person, I feel like there have been times in the beginning where I think I wasn't as great, but now I think as I've kind of progressed in the job, I think I can kind of actually tell in people's voices and their voicemails they leave me kind of what the situation is or how emergent the situation is to kind of address it. But yeah, I think kind of I think my Mercy associate journey was really helpful. I think in terms of finding a community within the social justice world. I think what's really interesting now is I have a lot of friends that aren't work, like they're working from home and they're not necessarily in a like kind of nonprofit world. And I think it's really kind of the divides of different kind of groups of people who are still all friends and can still all share such like great bonds, but yet also have such unique kind of life experiences, especially during the time of COVID. I think that there's a lot of potential to like really have wonderful friendships and great moments, but then also realize that um, your experiences also are valid and important, and need to be also had reflection time and things. And also kind of, I tend to do a lot of yoga and a lot of exercise in my kind of outside of work life, which is, I think, very helpful to kind of find the balance. I also am very connected with the Sisters of Mercy in Philadelphia, which I'm very grateful for. I've been living in Philly since my volunteer year and have had kind of different facets with each different volunteer crew. But I feel like through that, I've also kind of met more sisters. And then being an associate has also kind of helped me through that. So I think those are kind of great ways to kind of develop your community within the social justice world, because I think it can be very difficult at times when the work gets tough to not have other people to support you. But I have found that my social justice world has really grown. So I have so many friends that are kind of doing this work that it just makes it a lot easier to get through the really tough days, but also really cherish the really great days.
Yeah, I love that. Um, what do you think all of us can do to support healthcare, social justice, homelessness, and the opioid epidemic? What can our role be in that?
Yeah, so I think some really important things. I mean, advocacy is also really important. So in Pennsylvania, if anyone lives here, the deadline to order your mail-in ballot is like in next week at some point. I think it's the 25th or 24th of May to be able to order your mail-in ballot. So voting is obviously really important. I think Philly right now is struggling with kind of, I think, what to do with COVID and the incarceration system. So I think kind of criminal justice reform is always needed, but I think especially during COVID, we realized the vast inequities and inequalities people face and being incarcerated and being like kind of just in this petri dish of COVID and how to kind of manage that. I also just think our folks are just, I mean, just, I think, realizing that each person has a voice and a story, regardless of kind of what their concerns or conditions they might have, they're still a person, and remembering that they're a person before any type of health condition that they have. I mean, and I think just continuing to push for change, of course. I mean, we have a lot of different things going on in our governments right now. I mean, and that's kind of prevented the vast amount of testing that we've needed to have to kind of take on and really kind of address the things going on in our world. I mean, and I think this has also kind of proven that uh, health inequality really exists and really is detrimental to our society as a whole when we have inequality at all. In Philadelphia, in particular, the hardest hit hospitals for COVID are Temple and Einstein, which are located primarily in Black and Brown communities. So I think um, like finding out ways to support those types of hospitals and in your communities is really important. I feel like there's a lot of grassroots efforts across like kind of the country for supporting those communities, but I think that remembering that hospitals in those areas might be lower funded and lower resourced, but do provide a resource to folks that are so underserved and marginalized and really need to be valued in a much better way in our societies than they really are. So
Yeah. If you had advice for someone considering Mercy Volunteer Corps, what would you tell them?
So the Mercy Volunteer Corps, I mean, I think that I'm living proof that obviously my whole life was like literally now been here. I would have never pictured living in a big city for 1 year, let alone, I mean, I'm going, I guess, on my fifth year, fourth and 4.5. I mean, it's kind of wild to think about. And I cannot be more grateful for my Mercy Volunteer Corps experience. I mean, I would not have, I mean, my nursing school letters of recommendation all came from providers at Mary Howard, my Mercy Volunteer Corps site. I also forgot to mention, but I actually qualified for the Nurse Corps HRSA scholarship. So I had my entire nursing school education paid for through the HRSA National Health Service Corps grant, which is primarily because of my application essay that spoke about my Mercy Volunteer Corps experience. And so that is something that financially allowed me to be able to pursue my dream of going to nursing school. It paid for my nursing school in entirety, and I was allotted a living stipend each month. And in return, I will continue to work in community health far beyond my 2 years, but I have to at least work in community health setting for at least 2 years. But my continued goal is obviously, of course, to work in community health for the rest of my life. But those are obviously experiences and opportunities that I would have never had without my Mercy Volunteer Corps experience. I think take many steps back in my life and be like, wow, like if I would have done any other program, I mean, or even been placed in a different place in the country with Mercy Volunteer Corps, I would have had a completely different track and just different experiences, which I think is really cool. And I mean, it's really something that I do not take lightly about how important the Mercy Volunteer Corps is to me and how much it's kind of shaped the trajectory of my career. I think what's really awesome, especially in Philadelphia, I mean, the social justice scene is so real, and the health inequality, unfortunately, is so real that there are so many good people, and there's so many people who are wanting to make a difference and make a change, that I'm just so surrounded and inundated by people who are like my inspirations and heroes that like kind of walk around and are in these different facets of different health and community engagement. So it kind of propels me to kind of keep moving forward. And I think part of my reason like of pursuing, I'm in a part-time grad school program, but I eventually want to be a nurse practitioner. I mean, and that's really based on my experiences of working with such phenomenal nurse practitioners in my both Mary Howard experience, but also my pathway experience, which one of those nurse practitioners was in both settings. So it's pretty awesome to have kind of been kind of guided in the world of nursing by amazing healthcare providers, and to kind of continue to be able to grow in my career and become a nurse practitioner and work with such amazing people. I could not be more grateful, but I also realize all the things that kind of stem one point, which is the Mercy Volunteer Corps. So.
Yeah. How about advice for, we have a couple of, sorry, were you still talking? It skipped.
No,
No, okay. Sorry, it broke up. We have several current volunteers who are in the midst of transitioning out. Some will be in their placements for a little bit longer, while some just transitioned home. What advice do you have for those people who are transitioning?
Yeah, so I think that's such a unique and awesome time to be able to kind of take a moment and really kind of think about your experience in Mercy Volunteer Corps and also reflect. I know I've had some my housemates and my community mates in my Mercy Volunteer Corps year. One of them is in law school and she was at Project Home. So went a little bit different, but is in wanting to do community law. And then my other community, Fiona, she was at Mercy Neighborhood Ministries in working as a preschool aide teacher, and now she has her master's in teaching. So I think the options are really endless. I mean, I also have heard of people kind of doing one thing and then kind of transitioning to a wholly different kind of career path, which I think is really cool. I think what's been really awesome is the Mercy kind of world. There's so many connections and so many people. So I would say my biggest recommendation is to use your resources. Talk to as many people as you can. If you're interested in healthcare, you have me. You can always talk to me and I can kind of try to guide you. Of course, I know mostly about Philadelphia, but I mean, I feel like I know people who have lived in all different aspects of different kind of areas that have also done healthcare. So I could try my best to connect you with someone I might know. But use those people in your communities, but also the sisters, the Mercy Volunteer Corps, I mean, staff. I mean, I'm sure there's an alumni base that extends definitely to support all of the current MVC alums and people transitioning. But I think just taking the time, I think, to just kind of try to find what makes you happy and like your passions, and kind of maybe there was one aspect of your service site that you really enjoyed, or maybe there was some part that was like, maybe I don't want to do this in this way. But I think job shadowing is also really beneficial for certain people. I know I've had a lot of people. I'm always a big proponent of students and things shadowing me, kind of taking under the presumption that regardless if you want to do community health nursing, you're going to do community health nursing, because in every aspect of healthcare, you will encounter one of my patients in any aspect. So I think that that's also a really awesome thing. I know that certain jobs and certain positions don't necessarily allow direct shadowing, but I think that there's always kind of someone that can probably provide you some input about a certain field. Obviously, I'm kind of sticking more to the healthcare aspect because those are the things I know more about. But I mean, I'm sure that there are places in other organizations that you kind of learn more about through shadowing or just kind of reaching out to people. But I think also the Sisters of Mercy, just in general, I mean, they're experience, their vast knowledge. I mean, I like remember talking to a few of them when I first finished my Mercy Volunteer year. I had really no idea where I was going to end up. And then they were like, just kind of providing such inspiration, such insight, things that I feel like I hadn't even thought about yet. I did forget to mention, but I actually, after my Mercy Volunteer career, I worked as an HIV/AIDS medical case manager before I went to nursing school. So I worked at like an affiliate health center to Mary Howard and provided kind of direct care to people living with HIV and AIDS. And I think that was also a really unique experience to have, providing care in like a case management setting. And then kind of transitioning into my role as a nurse, because it kind of allowed me to kind of see both aspects of kind of the healthcare community health setting. Because of course, I mean, Medicaid and insurance applications affect my role just as much as any other role would, because if someone has insurance, then I need to kind of also support them through that. So I think kind of expanding your resume and expanding it in the right ways that you're passionate about would be my advice. And if you're passionate in healthcare, I would be happy to talk to you further.
Thank you, Hillary. At this time, I'm going to open it up to anyone else who might have questions for Hillary about her experiences now or when she was a Mercy volunteer.
Hey, Hillary, I have a question for you.
Hello.
So, as you said, you never thought that you'd live in a big city, so that I think there are a couple of potential or future Mercy volunteers here. So, going from never having lived in Philadelphia to now living there for 4.5, 5 years and having fallen in love with the city, what would you recommend how do you fall in love with the city and where you're serving? What did you do to fall, I guess, for Philly?
Yeah, so I think learning to love public transportation and just all the avenues and aspects of that. But I mean, I think greater than that, I think Philly has really kind of allowed me to just kind of be able to see such different communities and just different events, and there's so many things to offer. I think it can be tough in the transition kind of right after your service year to decide whether you're going to stay in that area or move somewhere else. And I know that was something that was tough for me. I really lucked out. I found roommates on Craigslist that, and it could have gone really bad. And I found some roommates on Craigslist. The room was really cheap, and I kind of fell into this kind of living community that kind of emulated a little bit of what my Mercy community was like. One of my roommates at that time had done Teach for America, so it kind of allowed me to have kind of a unique kind of housing setting. But as I said, I didn't know them at all. I found them on Craigslist. So I think that I also am coming from a very extroverted perspective, and these things can be very difficult. And even in my extroverted ways, it was tough being like, hi, I'm going to be your roommates. Like, let's start this. But I think that being more familiar and developing a community in your area. I know Amelia at the beginning of this call mentioned, there's a really cool, young adult, kickball rec league in Manayunk, also in the city of Philadelphia, but even just specifically in the subset in Manayunk where I live right now, is so cool. We definitely did that on my volunteer year, and it definitely cut into our Mercy Volunteer Corps budget. We didn't buy as many, fancy foods, but we had a great time in kickball. And all of us came from, the three of us, we all came from vastly different athletic backgrounds, and we just went in and had fun with the team. And I think that was really, really unique experience, and it's kind of propelled me. I've kind of, obviously right now I'm not doing any sports in group settings, but I think those are really cool ways to kind of meet other people your age and also kind of get into the community culture of the area you're living in. But it's not necessarily the easiest thing for sure either. So I think that's a great question for sure. Yeah. So, there's definitely, I think what's taught my Mercy Volunteer Corps year, I think has taught that me, living in the uncomfortable moments and making the best of those moments. So, I think that you have a lot of uncomfortable moments throughout your Mercy Volunteer Corps year. I know I had been in a health center working with people that I would have never imagined encountering, people who had such vast lived experience, and working with people had such vast life experiences than me, and trying to figure out different ways to navigate just life and just different experiences, and then kind of taking that and then also living in a new space and trying to figure out your way. It's definitely, it's tough. And trying to find a job that aligns with that, can be difficult, but I think one of the things that's been helpful for me is just kind of trying to find my community in my area. And I think some people are able to kind of volunteer. Some people volunteer in areas where they might have a college kind of connection or alumni association, which I think is also great. I going to a school in the New England kind of reach don't really necessarily have a college connection here. New York City does, but not really necessarily Philly. But I think those are also great avenues to kind of reach into your college community and college network when you're making a move. You never know the alumni connections that you have, but I think also speaking of the Mercy Volunteer Corps, there are a lot of alums in a lot of different places, and I think that there are a lot of different listservs and different opportunities. I know in Philadelphia, for instance, there's this program called Pause, which is a monthly potluck for people who've done a prior year of volunteer service. So it's every the last Friday of every month, they get a bunch of different people together from all different volunteer programs. It's any volunteer program, and you have a potluck and bring food and share a meal conversation once a month. And it's a lot of people who've done the Jesuit Volunteer Corps, which I think just happens to be because Philly has has a few different JVC sites as well as Camden's right across. But there are also some MVC people who have done it previously, and it's been just an awesome, like Selena's come with me a few times, Kathleen Kelly has come with me a few times, and I'm sure there are people who have also gone that I have not necessarily gone with, but that's a really cool thing that happens in Philly. And I obviously am speaking obviously directly to Philly, but I'm sure these are things that happen in other areas as well. But I kind of just keep, I think one of the biggest things for MBC was the community aspect. And I think that's kind of what's been important for me kind of going forward in my career, is just kind of finding that community when I kind of make these moves. But of course, I lived in Fairmount for 1 year, but I've come back to Manayunk. So I mean, my community has kind of been Manayunk since my Mercy Volunteer Corps year. So I'll probably still be here for a little bit. So yeah, if anyone has any questions about Philly or Manayunk, of course, reach out to me.
Hey Hillary, it's Amanda. So I have kind of a question back towards the transition that we asked about. So we work kind of with the same population, and you had mentioned that, you know, on a lot of days you're there with people in like both the best moments of their lives and sometimes the worst moments of their lives. And because of that, you kind of can form some like really deep relationships with these people because that's what our jobs are. So for us volunteers who have been in these communities, living in these communities, who are preparing, you know, now to get ready to say goodbye, and those of us who are going to be in careers where we continue to do this kind of service, do you have any advice, you know, for how to manage that transition, you know, when you're leaving a client or like when you know that your time with a certain population is ending? Like, how do you kind of, how do you be okay with that?
Yeah, it's a great question. I mean, I think goodbyes are always hard, never easy. But I think what's really, I think, important is to, what I found is to kind of keep it short, but keep it direct and keep it appropriate, and then keep it respectful, and then kind of move it onto another person. And I think it's very difficult, but I think some of those goodbyes can be really carried out and really difficult to kind of get back onto like an appropriate response, and trying to have that kind of, this has been a great experience, thank you for allowing me to share in your life, like citing some memories that have happened, and then kind of allowing it to have that space, but then also not allowing it to kind of be prolonged and then have to kind of readdress the kind of scenario again. I think a lot of times, a lot of the people that I worked with at Mary Howard, they were very frustrated and angry when I told them I was leaving. And I think that's where I kind of developed this kind of kind of short and sweet, to the point, and then kind of move it along, which I think was beneficial, to kind of respect the relationship that I had, but also respect that they have had inevitably a lot of change in their lives throughout a lot of different avenues of social services agencies, but also probably many different settings that they've experienced, whether it's behavioral health settings or just different hospital settings. So valuing that you are also a part of a different change, and that's okay, because you've had that experience and you've experienced that experience, and then you can grow and do whatever you choose with that experience, but not necessarily, it's tough. And I think that that's kind of where I've kind of developed this. It's really important to have those moments with the person, respect their experience, and then kind of try to end on kind of a positive note, so the person kind of leaves that knowing that you did all the best you could, and you care about them, and you kind of take that experience with you as you propel in your life.
Do we have any other questions for Hillary? All right. Thank you all so much for joining us here tonight. Especially thank you to Hillary for sharing your story with us and giving us some insights into Philadelphia and homelessness and healthcare and all of those things. This will be posted on our website, so if you would like to come back to it, you'll be able to there. Thank you all so much for being here, and have a good night.